Hi, everyone. You are very welcome. We are very delighted to have you on this webinar. My name is Marlene Momukunde. I am based in Kigali, Rwanda. I work for City Cancer Challenge. I am the project coordinator, coordinating all the activities that City Cancer Challenge is doing in the city of Kigali, but also working on with the digital health team, especially supporting them on the dissemination of one of the guidance they've produced. Thank you for being with us. We'll get started. I see we already have quite some number of people. I'll go ahead and give a few instructions and logistics on the webinar. We just want to let you know that this webinar is being recorded, as you already might have been notified. That's just for the purpose of posting it on our YouTube channel so that more people can get access to it. Second, if you speak Spanish, please note that we are providing translation for the Spanish-speaking people who have attended. The way to join the Spanish channel, at the bottom of your screen, you'll be able to see a world map. Please, when you click on that, you can see that there is an English and Spanish option. So if you speak Spanish, you can click on the Spanish icon to be able to join the Spanish channel. We have someone translating there. And I will actually ask Claudia to come and say that in Spanish, just in case we have people who can't hear English, so that they know that that is provided. Claudia?
Marlene, I will jump in because I can hear Claudia in the interpretation channel. Hola, bienvenidos a todos los que estáis conectados desde España, Latinoamérica o cualquiera que hable español. Mira, hemos habilitado traducción simultánea, y para poder acceder a eso tenéis que ir al icono del mundo que pone Interpretation, y si allí hacéis clic, ponéis Spanish, es Spanish, y entonces simultáneamente se va a ver que estará Claudia, que estará traduciendo todo de manera simultánea. Entonces, el icono del mundo, hacéis clic y ponéis ES Spanish. Sorry for the English speaker, I was just translating what Marlene, the instructions from Marlene in Spanish, so that our Spanish speakers can follow today's webinar.
Thank you very much, Isa. And without further ado, I'll run us through the agenda of the day of the webinar before we welcome Isa for her welcoming remarks. So as I just said, after this, we'll have Isabel Mestres, who is the CEO of City Cancer Challenge, to give us welcoming remarks. After that, we'll have Dr. Lumbwe. He will give us a short presentation on how he sees the guidance that has been produced by City Cancer Challenge being used by policymakers and at country level, but also at multilateral levels. Then I'll give description of what the value assessment guidance is. I will go into the methodology of it was produced and what it is about. Then we'll have two speakers after that, Dr. Izuna and Dr. Ishmael Che, to give us their experience as people who have already used this guidance in their normal life for their work, to tell us how that was. So that is, and right after that, we'll have a session for Q&A. As you've already seen on the chat, you are welcome to post your questions there, but we'll also have a session right after all the presentation to answer all the questions. In the meantime, you might also get answered via the chat. You have someone tracking that. So please, if you have any question, note that down, and we have a time for that. So I will then give time to Isabel to welcome us into this webinar. Thank you.
Thank you, Marlene, and welcome everyone dialing from all around the world. I think we're almost 100 participants, so this is very exciting. I would like to welcome especially to all SICAN stakeholders from SICAN cities that are joining, and all our SICAN partners and friends. I hope all the people dining from Latin America, you have a lot of coffee with you, because I believe it's very early. So thank you for your early joining. So I'm going to bring us a bit back in history. During the COVID pandemic in 2020, SICAN launched the Digital Health Discovery Forum. It was a forum that we brought, stakeholders, more than 100 stakeholders from all our regions and cities, to assess if there was momentum because of the COVID. And we all know some of the positive things that COVID came was the acceleration of the uptake of digital solutions. So we did a lot of discussions with our stakeholders to see what opportunities are there that we can accelerate solutions on cancer care to improve the life of cancer patients, leveraging digital interventions or digital technologies. And there were 4 areas that we took as a mandate to explore how digital solutions could improve the life of cancer patients. One was the area of diagnostics, many opportunities, a lot of advances in that area. Of course, training. And, despite there's a lot of digital fatigue of training, there's still a lot of opportunities to explore how we leverage that to reach more people and even having a more engaging training experience. The other one was patient navigation, a lot of opportunities there. And finally was the use of technologies for multidisciplinary collaboration, specifically in the markets where we operate, where there's no one center address everything, and the patient and the specialists are across a city and beyond the city. So how we bring that community together to guarantee quality interventions through the multidisciplinary approach. So since then, so 3 years back, we have been very busy, and we have been developing around almost 10 digital interventions across our cities. And we have seen incredible results beyond other interventions, because we have seen not only the number of healthcare professionals trained, I think we're in 300 trained, but also we've seen reduction on time from treatment to diagnostics. And not only the reduction, but also we could measure it through the digital solution. We've also seen reduction on pathology reporting. We've seen an incredible reduction on 40% reduction on days. And also we've seen an increase in early referrals. So there is a case, and it's actually driving outcomes together with the quality interventions assigned to the technology. But despite all the efforts and despite the evidence that we are bringing on these technical solutions, we're struggling on how to sustain the solutions. There is no clear tools to plan and evaluate digital health technologies in this resource-constrained setting. And it's very difficult. We're facing a lot of difficulties to convince the decision makers to keep and mandate the use of those technologies, despite the evidence that we are putting in front of them. In addition, we have identified that there is not a lot of alignment between software companies' business models and government payment models. And this translates into very poorly planned interventions, which do not take care about defining the process, the roles, responsibilities, or indicators to be tracked to assess the value of the interventions. For this reason, I think that the natural next step for us was to embark on this journey to develop a guide for effective value assessment and sustainable adoption of digital health interventions. We know they work, we know they bring outcome for patients. Now we need to sustain them. And this will enable the local stakeholders and specifically the decision makers from the cancer community to make informed decisions with confidence. So what are we doing now? And Marlene was already advancing some of the things. So I guess everybody has access now to this tool. So what we have done is we started conducting use cases in our network of SICAN cities to test the framework through assessment of the digital health interventions that we are deploying in those cities. The feedback of those sessions have been very positive, and commending for the guidance because it's comprehensive and user-friendly. And today we will hear some of them in the webinar, sharing their experience on uses this framework. The framework now is embedded in our internal processes for initiating any digital health intervention in any second city. And we hope it serves as a model to influence other decision makers in those cities to replicate the process for their own digital health technology assessment processes. Of course, we are already today socializing it, because this is for everybody to be used. And the more users of the framework, the more feedback that we get, the more we can improve together the framework. So with this, I would like to take the opportunity to thank the consultants that we tasked and that we've been working with them at Kilburg Dialogue, the contribution from all our partners and city stakeholders who have actively attributed. There's a lot of you, and you are all mentioned in the references of the tool. And to the rest of you, I would really encourage you that you socialize this among your network, and also reach out to us if you want to collaborate on the deployment of the framework, if you need guidance, if you want us to be, you provide feedback, but also if you want us to be part of your own assessment. I think we can all learn from each other. This is a challenge that we're all facing, but the opportunities, as I said, are massive. These outcomes that we're seeing thanks to the deployment of digital solutions on reduction of time from diagnostic to treatment, but reduction on pathology reporting, the increasing the early referral, all this translates, as you all know, on quality cancer care and therefore improve lives. So we're there, we just need to work together to make it sustainable. Thank you very much, Marlene.
Thank you very much, Isabel, for such inspiring, welcoming remarks. So we haven't given the guidance to everyone yet, but if you've registered, you will receive the guidance in our follow-up email. And as she was saying, you are very welcome to socialize among your network and to reach out to us if you want a one-on-one discussion on more explanation on how to use it. So next we'll have Dr. Lumbwe Chola. Dr. Lumbwe Chola is a professor and he's a health economist. He is a professor at the University of Oslo, and he's going to be telling us on how the guidance can be used for policymakers, policymaking for multilateral institutions, but also at the country level. Welcome, Dr. Lumbwe.
Thank you very much, Marlene. Thank you to City Cancer Challenge for affording me this opportunity to speak. And I'd like to start by saying congratulations on producing this, this guidance. I think this is a huge milestone, not only for CCAN, but I think that there's a lot of people that are working in the area of priority setting in healthcare, and specifically health technology assessment and value assessment of technologies. And this guidance, I think, is very, very timely. In my discussion today, I will talk about my experience with value assessments in healthcare, the need for evidence-informed priority setting, and how this value assessment can inform evidence-informed priority setting, how countries and the global network of thinkers in healthcare has collaborated to work on health technology assessment as a tool to support evidence-informed priority setting, and just generally some recommendations on how this tool can be deployed and used to inform priority setting in Africa, in Asia, globally, I guess. Now, when we talk about the need for evidence-informed priority setting, I think it can't be overemphasized, and the best place or the best description of the need, especially post-COVID, I found in the World Economic Forum report for 2023, in both their strategy and their guidance. And I would urge everyone to read this report. I think it's very informative. Now, post-COVID, we find ourselves in a paradoxical situation where we have increasing productivity, a surge in healthcare spending, and so on. But also at the same time, we have a widening gap in health inequalities. And I think that the way that countries have responded to this is to increase their focus on priority setting. Increasingly, we're looking at countries starting to demand priority setting efforts. In their policy documents, you see catchphrases, you see increases in demand for health technology assessment, for example. This is both in Asia and in Africa, and countries looking at supporting evidence-informed priority setting and using HTA to support evidence-informed priority setting. I think there is a brief lag between my changing the slides and the slides changing. So you will have to forgive me if I seemingly speak and you cannot see my slides changing. But moving on, I think how countries have used health technology assessment is in three ways: to inform coverage decisions about, for example, what they should cover in their insurance packages, the essential healthcare programs or the essential healthcare packages and so on what they're going to procure in healthcare, and also focusing on guidance in clinical care. Examples of this we'll find in the literature. In Rwanda, for example, HTA has been used to inform whether dialysis should be included in the benefits package. You have economic evaluations and HTA of safety engineered syringes in India, where they use that to look at pricing and whether they could procure these syringes. And of course, in Ghana, recently produced a health technology assessment of hypertension was used to guide decisions on how they could change their clinical guidelines and so on. But as we speak, and I'd like you to keep this in mind, that most of this guidance or the use in HTA that you find in the literature at the moment, especially in low and middle income countries, is mainly focused on procurement of pharmaceuticals. Now, because countries are beginning to demand HTA, there are a lot of efforts at the country level, efforts at the regional level, and efforts at the global level to support evidence-informed priority setting in low and middle income countries, or at least how HTA can be institutionalized and structured to use to inform priority setting. I work in a network called the International Decision Support Initiative, which is a grouping of universities, governments, and other stakeholders that are thinking about how we can advance priority setting and use HTA to advance evidence-informed priority setting. And within the IDSI network, a few years ago, we produced a guidance which we called the reference case for economic evaluation. Even though it was, touted as an economic evaluation guidance, our thinking was mainly around health technology assessment and how we can inform health technology assessment. And you could say that it's a limitation in a lot of thinking on health technology assessment in low and middle income countries, that a lot of them seem to focus on economic evaluation. And I hope that you keep that in mind, because when we come to talk about the tool that CCAN has produced, we'll talk about just how wide-ranging that is, and it goes beyond economic evaluation to look at how to perform value assessments. Now, a few months ago, I think at the beginning of this year, the Africa CDC, the African Union, set up its technical working group to inform the development of an Africa-specific guidance on evidence-informed priority setting. And here as well, the thinking is around how we can use develop a framework that member states can use to institutionalize evidence-informed priority setting, and more importantly, how we can use health technology assessment, or how countries can institutionalize health technology assessment. Last month, we were in Nairobi, and this was the first meeting of this technical working group, of which I'm part of. And there's a regional effort there that is looking at guiding countries on institutionalizing evidence-informed priority setting. And I think that this also is an area where this guidance that CIDI-CANSA is producing can be utilized. We of course find other examples of such regional efforts. For example, in Latin America, you have the HTA agencies there, and evidence-informed priority setting, that are thinking of similar interventions. You have HTA Asia Link in Asia that is also producing similar guidance. Now, at the country level, of course, there are several other countries, and here I'll give another example, just one example of how HTA institutionalization is being done in Ghana, but across Africa, across Asia, for example. You have HITAP in Asia that is, I think, a beacon for evidence-informed priority setting and HTA in low and middle income countries. Rwanda is thinking about institutionalizing HTA. Kenya, Zambia, you find examples everywhere. And here I'll give you an example of what's happening in Ghana. Ghana started to formalize or institutionalize their HTA. I think accelerated this effort starting around 2018. In 2021, they produced their strategy for health technology assessment, and last month they launched their reference case for health technology assessment in Ghana. One thing when you look at this reference case, it's a guide on how Ghana wants to do health technology assessment, but the focus mainly of this guidance is also around economic evaluation. It's a very good document. You could read it. You could pick up the document from South Africa as well, from Nigeria. I think there's a similar reference case, but the limitation in most of these is that that focus on economic evaluation and not the other elements of priority setting and HTA. efforts in at the country level are also not only limited to health technology assessment, but you begin to see more and more of these priority setting initiatives being applied to health benefits package design. For example, in essential healthcare packages, you pick up the document from Ethiopia, especially. They have a very structured way of thinking about priority setting, very similar to how you do your health technology assessments, but these health technology assessments are really being applied to coverage decisions in a lot of countries. Now, even though we have this increasing use of health technology assessment, of institutionalizing priority setting processes, there's a lot of limitations and barriers to producing evidence, producing health technology assessments that can inform priority setting decisions. Here I would like to highlight this evidence comes from the WHO survey on health technology assessment and health benefits package design. That a limitation or a barrier that is often cited is knowledge of methods for producing and using health technology assessment or using evidence to inform priority setting. And when we look at exactly what the challenge is with the methods, is that there is a lack of harmonization of methods across countries, across regions, globally. When I worked on health technology assessment in Ghana, for example, I continue to work in Ghana, supporting the Ministry of Health in their program. The challenge is that we have various partners that are advising the Ministry of Health. You have the Norwegian Institute of Public Health, for example, with this version of health technology assessment. You have the London School with this version of health technology assessment. And some of this guidance, when it's not harmonized in the country, it creates a lot of challenges. Another challenge which I highlighted earlier is that there's always a focus on pharmaceuticals, and I guess I understand why this is the case, because this is an area that is easy for us to do health technology assessment, especially when we don't have a lot of evidence or information to produce these HTAs. The challenge has been that we have not done quite a good job when it comes to informing other technologies such as medical devices or digital health interventions, or the social determinants of health. And this is where I commend this guidance that SICAN is producing, that it adds to the body of knowledge on how to produce a value assessment or a health technology assessment. Now, very good guidance from City Council Challenge, and I think I was given a task by Marlene to think about how this guidance can be utilized, or how it can be used to guide evidence-informed priority setting. And I think that we have to develop a theory of change for decision support. And there are examples of theory of change for decision support. And here I picked the IDSI, or the International Decision Support Initiative for decision support, thinking about how can we organize ourselves in order to produce better health outcomes for our populations. We start by developing effective partnerships, and that these partnerships acknowledging the fact that priority setting is a multi-stakeholder initiative. So we need local partners to galvanize or to support evidence-informed priority setting. And from there, we need to increase efforts in institutionalizing evidence-informed priority setting. And here is where the guidance can be most useful, in that it helps us to be technically efficient and technically better at producing the guidance that informs the decisions and brings stakeholders on board as well, and then helps us to make better decisions. The only way I think that you can improve on this guidance is if it is continually utilized, and that we support efforts that are currently going on across the globe to inform or to institutionalize decision support. The guidance can also be used, I think, in development of capacity or in capacity development and capacity strengthening, especially in low and middle income countries, and that the theory of change is very much similar to the one that I've just previously showed, in that our aim or our main goal is to ensure a better health for all. But the activities and the inputs for which we use to produce that impact or that goal starts with us building capacity for both producing and for using health technology assessment or value assessments in low and middle income countries, and that we could use this guidance in training, for example, in technical assistance and mentoring, and in the technical projects that are ongoing in a lot of the countries. And to summarize, I would urge SICAN and, of course, the partners and stakeholders that are listening in today to continually engage local and international partners to use this guidance. And I think that this guidance, as we continue to use it, helps us to harmonize the standards across regions and countries on how we produce value assessments. At the country level, I think that institutionalizing evidence-informed priority setting is key, and we should use this guidance increasingly to look at devices and digital health interventions. And of course, we need to improve or increase our efforts in capacity development, and I think that this is where this guidance could actually make a very big difference. So I'll end here, Marlene, and just to say thank you very much for listening in and for inviting me to speak.
Thank you very much, Dr. Lumbwe, for a very detailed presentation and for your recommendations on how the guide can be institutionalized at different levels to ensure that it's implemented. Now to really go into the details of what the guidance for value assessment is, I will take you through that, but before I do, I will take a minute to just also explain a little bit more about City Cancer Challenge and what City Cancer Challenge does. Next slide, Ivana. So City Cancer Challenge it was launched back in 2017 during the World Economic Forum by the Union for International Cancer Control. And it was later on established as a standalone foundation in 2019. We are based in Geneva, Swiss. And our vision is to support cities around the world to improve the quality of their cancer care. We are currently in 13 cities on the next slide. We are currently in 13 cities. We work in low and middle income countries. So we are in 3 countries in Africa, 3 in Asia, 1 in Europe, and we have 6 cities in the Latin America region. Our model, our city engagement process has 3 phases. The first phase has 3 pillars. which starts by a city applying, and then once a city has applied, we do a due diligence to look at their capacity, how do they look like, what do they have, and then afterwards we start a stakeholder engagement phase, whereby we really try to see who are the people who should be speaking in terms of cancer care or improving, strengthening cancer care in the country. In this process, we involve civil society organization, private organization, and government institutions as well. And once we've brought them together, we conduct a comprehensive needs assessment of the situation of cancer care in that city to really understand the challenges and barriers that are in the city at the moment. And once that phase is done, we go into the second phase of empowering the city, where we start our solution planning activity, where we bring together people, especially clinicians, patients, really people, stakeholders from various organizations, to start the process of developing solutions that are best adapted to the challenges we've identified in the needs assessment. And then we task, or the city task, small teams to start a project development phase, where they go and develop some set of activities that should be done in order to improve the challenges that were identified. And in the last phase, that's the phase of execution, and there we start to transition towards sustainability of the project we've started in the city. And as you will see, our cities, the 13 cities, are at different levels, because every year we enroll new cities and we continue to move them through the various stages at different, on the different pace. On the next slide, this is a list of our partners. We work with various partners in the private sector, in the UN, really a very diverse list of partners that we work with across the world. Now diving into what we do in terms of digital health on the next slide. The way we support digital health interventions is based on the 6 pillars. First off, we support the cities or stakeholders in the city to identify impactful digitization opportunities, and that can come through some of the results we see in the needs assessment that we conduct, or during the solution planning. We support them to see what are some of the barriers that can be addressed through a digital intervention. And once we've done that, we support them to develop the protocols and policies related to that before we go into the process of making sure that they have clear technology requirements that will go with the digital tool they've identified, to make sure that everyone is aligned. And then obviously, as we do that, we also continue to make sure that there is enough capacity development that is going to be able to use the digital tool, which is a really strong component, as also Dr. Lumbe has mentioned. And in the meantime, we are working at a larger scale, ensuring that the local innovation ecosystem is empowered. And lastly, we support the city or the stakeholders to assess how the digital intervention they've started is going to improve, or what value it's going to bring to the entire health system. And that is where this tool, or this guidance that we've developed, thanks to the consultants we worked with, it comes into the picture. It's really a guidance that is going to support us, especially on this last pillar of evaluating the value of the digital interventions. On the next slide, so as Isabel mentioned earlier, really the purpose, so really I won't go into much into why we developed the guide, but some of the objectives of how we see this tool helping us at the SICAN level, but also going beyond, as Dr. Lumbe mentioned, is to support the transparency and completeness of digital intervention process evaluation, because we realize that in some cities, they obviously evaluate digital health interventions, but there's no clear processes on how they do it. The providers don't know when they want to provide their their digital tool. They don't know what are the requirements or what is the process to follow up on. So we are helping and really aiding towards this first objective of bringing transparency. And second, we also want to support, whether it's the providers, whether it's the person needing the digital health intervention, or we want to support them to know what are some of the relevant information they need to their tool to have in order to make sure that their tool is accepted at the national level, or that it's going to be sustained over a long period of time. And lastly, obviously, we also want to support the decision makers at country level, but also at other levels to determine the value before they adopt a digital health intervention. And in terms of how the tool, the guidance was developed, if you go on the next slide. The methodology, first off, the consultants we hired to develop the tool, they reviewed the existing frameworks in terms of a health technology assessment, and after producing that first draft, they conducted, they received feedback from academia, NGOs, and other policymakers in low and middle income countries. And after that, they developed some use cases on some of the digital health intervention in cancer care, going into radiology, therapatology, monitoring of cancer treatment, side effects, and on the multidisciplinary digital tools. And they distributed those use cases to stakeholders in the middle income countries and conducted interviews with them to receive feedback on how they saw that the guidance was fitting in assessing those use cases that they had developed. And after the feedback they received, that's why they came up with the final set of domains that the stakeholders deemed very necessary to be in the guidance. Just to also make sure that we all understand that in terms of the scope of the guidance, it really focuses on the providers, on the healthcare providers, and on the digital health intervention that are supporting data services. That could be data collection tools, digital tools, or really any other tools that is around data management and data storage. So we did the tools envisaged in this guidance do not really include clients or patients or health system managers that will be administrators in the hospitals, etc. And then on the next slide, as Dr. Lumbe also mentioned, the guidance can be used in various ways. It can be adapted to various contexts. It can be used at different levels of decision making, but it can also be used at different levels of designing or already procurement of digital health intervention. It can be used during the ARI Direct to make sure that there is alignment. As Isabel mentioned earlier, to make sure that before an intervention is implemented, everyone is aligned on what it is going to be solving. Yeah, it can be used obviously during the designing process to make sure that the users, it is capturing the relevant criteria that everyone agrees on. It can be used in terms of identifying the right indicators to monitor to show its value. It can be used for appraisals and assessment of when during the deliberation process of defining or really choosing or selecting a digital health intervention. And it can also be used during procurement. Now on the next slide, these are the 7 domains that were selected by our stakeholders when we conducted interviews with them. These are the 7 domains that they deemed as the most important to think about when assessing a digital health intervention or when thinking about a value assessment of digital health intervention in low and middle income countries. It's important to notice that the order doesn't matter, but it can be, the domains can be changed or they can be prioritized depending on the intervention or on the user of the guidance. Now diving into the first domain on healthcare system program, This first domain really revolves around the health system. What is the problem that the digital health intervention is coming to solve? Is it around making sure that there is accurate diagnosis? Is it around information and sharing? So the first one is really around what is the purpose of the tool? What is it going to serve? Secondly, there needs to be a clear thinking around the users and their needs. Who are the users? Are they patients? Are they nurses? Is it going to be used in the laboratories? And in terms of beneficiaries, again, is it going to serve the patients? Is it going to serve the nurses or the payers? And lastly, on the last 2 points to think when thinking about the large health system or health ecosystem. The first one is to understand what was already being used in the system. And this will come back later again in terms of interoperability. We don't want to disrupt the existing mechanism that were there, but we want to make sure that we are fitting perfectly into it and that we are improving the existing methods. Lastly, we want to think about the contextual issues around any enablers or barriers to adoption of the system. Is it aligned to the existing national e-health strategy? Is it going to need lots of internet? Is it user-friendly? Is it easy to use by the users? Those are some of the contextual issues. And on the second domain, and this is really around the technical product information and use. The first one is around if the tool is clearly described. Is it described hopefully around based on the WHO classification to ensure that there's harmonization across different countries? And is it interoperable? Is it compatible with other systems that are being used? What are its functionalities? Secondly, transparency. This is really a very big aspect, especially for digital tools. How is data going to be processed? Who is going to use it? Have we sought the necessary consent? What is the policies around privacy, etc.? And on the quality management system is really around how are we going to continue to ensure quality in terms of how the system is functioning, that what is providing is also of good quality. Are we going to need refresher training? How is troubleshooting going to be provided to make sure that this is also thought about? And also continuing on the next slide, still on the same domain. This is one also of the main subdomain around the methodology that was used to prove the functionality of the tool, and also to really understand what the tool is about. Is it going to need to input any images or what was the algorithm that was used, really to understand its functionalities and how the functionality was tested. And maturity of the application or the next subdomain to make sure that it's aligned with the user needs and that it's fitting very well with the clinical workflows, and that obviously it's been hopefully tested in other markets and its value and impact has already been proven in other markets for market availability. And on the next domain, which is around usability and accessibility. So on the first subdomain on the clinician user experience, this is something we really came back to many times to make sure that it's not disrupting the usual pathway that the clinician is using, that it's rather fitting and really improving their work in some sort of ways. And also on the patient experience, how is it, what is the satisfaction and how useful are the patients finding the tool? It's also important to think around things like patient feedback, to conduct surveys to know what are their feedback on the tool, but also any other users that might be using the tool, like IT or any other healthcare workers that might be using the tool. On the fourth domain, around the safety, again, this really comes about around transparency, making sure that there is technical safety that is proven, that is reliable and stable, that it is following the data protection laws of the countries, that is following all the policies and the regulations set by the country, that it is clinically safe in terms of it's not providing false positives or false negatives, and that it is following the right clinical protocols depending on what the tool is about, and that is really using the guidelines that have been established by the relevant institution, if it's MOH or others. Also that there is a clear, for example, alerts or other things that will be able to communicate the user around any critical risk that they need to take care of. On the fifth domain, around effectiveness, this really around if the tool is improving the health outcomes or improving the work of the users. There needs to be an aspect of already defining what it is that we want to improve in terms of the users. Is it about their work? Is it about it's going to save some time, it's going to save some resources, but also thinking a long term in terms of health outcomes. Is it going to influence or touch on morbidity or mortality, on improving the quality of life? So really making sure that you can prove how the digital tool is improving the health outcomes or the user's work. On the sixth domain, so the sixth domain is around cost and the economic evaluation that Dr. Lumbwe touched base about. We want to already know ahead of time how much the tool is going to cost. In terms of startup, are we going to need to purchase some equipment? What are some infrastructure that are going to be used? How is it going to influence the healthcare system cost or the individual cost? Is using the tool going to influence the cost of the patient in any way? But also on this aspect, really thinking about some cost savings that could be done thanks to using the system as well. And the last domain is on the ethical aspects, and this is really around making sure that it is following equity, it is non-discriminatory, non-stigmatizing, and that again, data has been provided consent for where needed, and that patients have been involved in the process where that needs to be, and again, data security, again and again, and then on the issue of responsibilities, making sure that the users are clearly defined, the people who will be providing troubleshooting and monitoring are clearly defined, making sure that everyone knows their roles and responsibilities ahead of time. So these are the 7 domains that are in the guidance. Just to remind everyone that we're going to send the guidance to everyone at the end of or in the following days so that you can have more details. We welcome feedback and questions, but just for this webinar, we also want to have a few people who have already used this guidance tell us about their experience on using the guidance, also who have been part of developing the guidance to tell us about that experience. So without further ado, I will have Dr. Izuna tell us about her experience.
Hello, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, good evening, and good morning to all of you, wherever you are. I'm Izuna. I'm from Malaysian Health Technology Assessment Section, the HTA agency in Malaysia. We are under the Ministry of Health Malaysia. So thank you to City Cancer Challenge for involving me in the development as well as the opportunity to speak during this webinar. So Greater Petaling in Malaysia is one of the City Cancer Challenge. Is one of the City Cancer Challenge. All right, before let's see whether it moves. Okay, before I proceed further, I have a disclaimer that the opinion or views expressed in this presentation are my personal opinion. Okay. So this is what I will touch today regarding digital technologies and HTA and involvement in the guidance development and how the guidance can be used. Okay, as we know that digital technologies are essential component and an enabler of sustainable health system and universal health coverage. As has been discussed during the COVID-19 pandemic, has shown that digital technologies is very important to ensure that we have better access to health for most of our patients. So digital technologies is a very broad scope. It covers from robotic, artificial intelligence, Internet of Things, blockchain, visual reality, as well as big data. Okay, next. All right. So maybe the slide before this. All right, okay, next. Okay, having said that, not all digital technologies may have high value, for example, and although we said that digital technologies may be of low cost, sometimes the capital cost may be higher. So health technology assessment is very important to assess the value of the technology itself. So what is HTA? HTA is a multidisciplinary process which uses explicit method, which is formal, systematic, and transparent, and it evaluates the value of the health technology at different points in its life cycle, from the developmental stage up to when the technology is become obsolete. And the purpose is to inform decision making to promote an equitable, efficient, and high quality health system. So Malaysian Health Technology Assessment, in Malaysia, we have been established since 1995, and our functions cover the life cycle of the health technology. We have horizon scanning activities, we conduct early dialogue, or we provide scientific advice, we conduct health technology assessment, and we also develop clinical practice guidelines. Okay, next. So we have reviewed several digital technologies. What we found is that there are several challenges in evaluating digital technologies. One is that the traditional HTA may not cover all factors relevant to digital tools. In terms of, for example, the accessibility, the data security and protection, and also the interoperability of the digital system with the current system that we have. And sometimes there's no appropriate comparison to compare this digital technology. And the digital technology evolve very fast. Sometimes we are evaluating the 1.0 version. Before we finish the evaluation, there's a new version has come out. So it's a challenge to health technology assessment agencies to evaluate these digital technologies. And there are variations in the technology. And one of the important things is that most of the time there's lack of evidence. There's not enough evidence, there's insufficient evidence to evaluate these digital technologies. Next, so I'm excited when I was approached by City Cancer Challenge to be involved in the survey and interview in the development of this guidance itself. And as I know that this is an important thing, and there's no guidance available yet in my country and also in other areas of the world as well. So we also have a panel discussion at the Expo Asia Pacific on can we do better for HTA assessors and patients in terms of mistrust in digital health technologies for Asia Pacific, and this is published in the Expo newsletter. So next. So after the development of the guidance, we'll also been engaged with the consultants in terms of the implementation. So a series of workshops were conducted to brief our stakeholders. So many important stakeholders being involved in Malaysia, including the HTA assessors and the MATAs. We also have researchers, innovators, clinicians, patients as well, and also digital technology related officers to brief them on what is the guidance about, as Marlene has delivered just now on the 7 value domains and how it can be used. We also use case studies to elaborate further and to test the usability of the guidance itself. Next. Thank you. So we have conducted an assessment, a mini HTA on artificial intelligence chest X-ray for lung cancer screening. So we use this report as a case study. Actually, we have 2 case studies. The other one is on AI for breast cancer screening. But I think I will focus on this AI chest X-ray for lung cancer screening. This is to test the usability of the guide, and we also involve all the stakeholders to get to see whether the stakeholders actually agree with the value that has been proposed in the guide and how they think that that is important and whether it is useful in the evaluation of the digital health technologies. So a deliberation scoring was done, and also post deliberation scoring. As we can see that there are several domains and subdomains where we can score whether it's sufficient, it's partially sufficient, not sufficient, or not required. Yeah. So all the participants in the workshop were given the reports, and they were also given the value domains for them to do the assessment. Okay. So we found that the different stakeholders may have prioritize different value actually, but all things that this guidance is actually is good and agreed on the value that has been proposed, the 7 domains value. Okay, and it is a useful tool to evaluate the digital health technology itself. So how the guide can be useful? One, it helps the reviewer to identify the evidence or information required for the assessment. We know that the assessors, HTA assessors, are not IT person actually. Yeah. So this guide can help them to search for the information, and also to ask the innovator or the manufacturer what are the other information for them to provide for the HTA assessors to evaluate the value of the technology itself. Yeah. And it also enhances transparency when we can discuss actually with the manufacturer or the innovator what are the values required. Yeah. Sometimes the technology developer perceive that HTA assessors may not understand the digital technology itself. So these tools actually helps them to communicate better. Yeah, and it can be used to facilitate discussion, yeah, on the value of the technology and identify further areas for research. For example, when we say that there's insufficient evidence for us to evaluate, so what is the evidence that is required? So it's easy to point out because it's clearly stated in this guide. And for HTA assessors, this guide provide the important value, what to look for, but it's not a methodological guidance. How to conduct HTA is not in here, but what are the value that you should look for is in the guide itself. Okay. Next. So based on our experience in using this guidance, how it can be used, I think for the technology, this guidance not only for HTA assessors, but it is good for technology developers or researchers to understand the important domain in value-based assessment. So when you develop digital technologies, you would like it to be adopted by the healthcare system. Okay, in order to do that, evidence actually needed, okay, to prove the value of the technology itself. So this guide can help you in terms of to generate the evidence for the evidence generation planning and also submission. So this tool can also be used by the HTA agencies that conduct early dialogue or scientific advice for you to discuss with the technology developers and in terms of the evidence generations itself. Yeah. And also to guide in assessment. Oh, wait, I have not finished. Guide in the assessment. And so for policymakers to guide in their decisions, but it must be context specific. It depends. We know that digital technologies, the purpose is also varies, and there are various types of digital technologies. So it must be also context specific. What is important in the value assessment of that specific digital technologies from all the 7 domains itself. It can, okay. And in terms of funders, it provides a more objective measure to prioritize funding itself. By that, I would like to congratulate City Cancer Challenge for the development of this guidance, and thank you for this opportunity. Thanks.
Thank you very much, Dr. Izuna. We'll now quickly move to Dr. Ishmael for his presentation on the MDTK's presentation in the city of Kumasi. Welcome, Dr. Ishmael.
Hi, thank you. Thank you very much for the opportunity. Good afternoon from a very beautiful Ghana. Next slide. Great. We are aware of the impact of the multidisciplinary team practice in the management of cancer, especially in resource-limited communities like the one I'm in. We find the MDT as very critical in managing cancer patients. Up until now, we've had challenges with our MDT in Kumasi because we've done things physically using paper forms and discussions, which until COVID was always done in the component institutions, limiting access to patients and doctors outside the teaching hospital. COVID brought along the use of Zoom for some of these meetings. Because of these challenges, we never had the full complement of the MDT majority of the time. And hospitals we serve outside Kumasi had difficulties accessing the MDT meetings. So CCAN, through our local team, was able to enhance our MDT services by introducing a digital platform, which we have developed to help enhance our MDTs. Next slide. So we set up to develop and operationalize the virtual digital platform for the MDT meetings, like I mentioned, for breast and cervical cancers. Ultimately, we are hoping to have a platform that can be scaled up to include almost every part of the country, because we, from our initial assessment, felt it really would improve cancer care for our patients. Next slide. So for those who are not familiar with Ghana, Kumasi is located almost in the center of Ghana in the Ashanti region. For those who can see Ashanti region somewhere there. We in Komfanoche serve a very significant proportion of Ghanaians. Most of the hospitals above us, and even to our neighboring countries, Togo, Ivory Coast, and Burkina Faso, access our comprehensive cancer treatment center. The Komfanoche Teaching Hospital, through CCAN and its development of this MDT platform, is going to, aside the teaching hospital itself, augment MDT practices in 3 Ghana Health Service hospitals located in Kumasi, 1 private hospital, 1 quasi-government hospital, and 2 faith-based hospitals in Kumasi. Because of the impact our MDTs have had over the time, we even have cases from outside the region. So we have cases as far from Kumasi as Tamale, which is in the northern region. If those who are seeing the map see the northern regions to the upper part of Ghana, and they send cases all over to us. So we feel including them in this virtual platform would go a long way in helping their patients to, so they also be involved in the development and very soon the implementation of this virtual platform. Next slide. Fortunately for us, this our platform, aside everything, also has this DICOM app, which would enable our professionals from outside our teaching hospital upload images and slides from pathologists. And with the experts we have in Kumasi, patients will not have to move all the way to come and show slides, come and show their films from radiology. our experts in Kumasi can, through this platform, interpret and discuss pathology slides and radiological slides. And we believe this will really go a long way in cutting down patient transport times and inconvenience in their management. Next slide. So after our initial review of the app, we did a value assessment of the app, and we saw a few weaknesses which we pointed out, and as I speak are being worked on. And ultimately, when the app is finally launched, all these minor weaknesses and risks will be incorporated and reproduced. Our app needs internet. Ghana is not doing badly with internet access, but we are hoping that we'll make available internet facilities in these health institutions. We are really looking forward to helping. The app will require a little e-health literacy, which can easily be provided. We found a few missing sessions in our app, like a session to capture patient consent to treatment after the discussion at the MDT. We want evidence of feedback from treatment outcome. How did the patient do on the treatment the MDT advised? So we are going to get the app developer to incorporate these into the app. Also, we wanted an idea about the cost of the platform, because going forward after we are weaned off the support of SICAN, we still want to continue with the app, and we want to know how much it costs and how we are going to finance that going forward. There were a few risks about patient data, risks with the system's security, etc. All these are also being looked at, and ultimately we hope to overcome these questions and therefore get the app maximally functional. Next slide. So for us going forward in Kumasi, like I said, we are going to, the local team has been meeting already. The next meeting is scheduled for next week to look at these risks and defects of the app and make these recommendations available to the technology provider. We're hoping to work with the technology provider to finalize the platform and get the local team and these hospitals hooked on, so that we will experience this enhanced effects of a more efficient multidisciplinary team platform, which would ultimately lead to improved patient experience and improved clinical outcomes. Thank you very much for your attention.
Thank you very much, Dr. Ishmael, for telling us on your experience with using the guide to evaluate the MDT case presentation tool in Kumasi. So we are now in the session for questions. So we remind all our attendees to drop your questions on the Q&A or on the chat. And some of the questions have already been answered by one of our staff, Fred. But so far I see one question from Tosin Adeni Adekunle. So he is asking, how can healthcare startups or existing companies contribute in initiatives involved in monitored healthcare and controlled medication administration? So I think we can direct this question to our first speaker, Dr. Lumbwe. If you've seen the question, do you want to address this first question?
Yes. How can startups contribute? I think that there are two things that happen when you're looking at health technology assessment, for example, that it depends on how it's organized in a country. In some countries, it's done and run by the government. In other countries, it's companies themselves that are supposed to submit, for example, an assessment to a country. But I think that more and more, especially in low-middle income countries, we're seeing a lot of collaborations between private sector and the ministries of health in looking at value assessments. I would suggest that as a startup or as a private company, you pick up the guidance and use it in a way that you are going to inform deployment of a particular technology that you want to work on with the Ministry of Health. But I think that there's room for both private sector and the government to work together in value assessments.
Thank you very much, Dr. Lumbwe. So we have another question from Mr. Khalid. He's asking, in countries where digital health technology is non-existent, what would be the first step to kick things off? And in such a scenario, how can SICAN support? So I would like to direct the question to Dr. Izuna, at least the first part of the question, and then we'll have Isabel tell us on how SICAN can support in context where there is no digital health technology. So Dr. Izuna, if you could answer the first part of the question, how things can be kicked off in context where there is no digital health technology. And then Isabel can explain a bit on how SICAN can support.
Thank you, Marlene, and thank you to the question in terms of what would be the first step. I think first is you must create awareness on the importance of the digital health technology, how it can help to improve the healthcare system. And based on our experience, a conducive ecosystem is very important to ensure that digital health technologies can be implemented. One is to ensure that we have the connectivity, we have the technology, and we have the environment that can support the technology itself. So awareness among the policy makers, the government agencies is very important. Thank you.
Thank you very much, Dr. Izuna. If we still have Isabel, can you tell us how SICAN can support in countries where there's no digital health technology available?
Dear Marlene, sorry,
Yes.
I was disconnected for a while. Can you repeat the question, please?
So yes, so the question is from Mr. Khalid. So Dr. Izuna already answered his first question, which was in countries where there is no digital health technology, what can be the first step to kick off things? And so Dr. Izuna supported in terms of the local stakeholders, what can be done at their level. But then he also had asked how SICAN can support in such context.
Yes, okay. So from a SICAN perspective, of course, we are only working in, we can only support the cities that are part of the network. So we're going to be soon doing a new call for application. So we are more than welcome to explore bringing other cities into the network. And how that are not part of our network, I think the how we can help them is with the evidence of the impact that the solutions that we have deployed have had into the cancer cares and the health system. I think that's the first step, because with that evidence, I think there's going to be much more appetite to open the conversation. So this is something that maybe we can follow up and bring that, show that evidence and the impact that we're having with anyone that wants to start conversation with the government.
Thank you very much, Isa. So Martinez is asking that most of us spoke about some distrust that is among some healthcare providers and the population to trust the digital tool that is being brought. What are some of the strategies we've used to overcome this? And I'll direct this question to Dr. Ishmael. Perhaps you can already tell us about the MDTK's presentation or any other digital tool that has been used in Kumasi. What are some of the strategies that have been used towards this trust of the health team?
Yes, for us, basically, it's getting the major stakeholders, which are the members of the MDT, to appreciate the value addition, the transition from paper would add, and the patient concerns, especially for developing countries like ours, transport time, rates of transport, inconvenience, etc. So if all these can be saved to the patient, the inconvenience of having to travel just to come for a decision of an NDT, for instance, if all this can be save the patient, saying that the patient only comes for an intervention, and everybody comes to an understanding that this tool becomes an improvement of the patient experience globally. Just doing that will get majority of people on board, and implementing such an intervention would be carried on because of the enormous advantages the intervention brings.
Thank you very much, Dr. Ishmael. So we'll take the next question from Andrew. So his question was, in context where paper-based is being used, excuse me, I'm trying to roll. See the question, missed it for a minute. So for countries with paper-based medical records, what is the experience integrating decisions or data shared digitally back into the paper-based record? If this is a difficult task, what are the opportunities to address, and what impact does the additional effort have on the value assessment? Is it minimal or is it significant? So I will direct this question to Lumbwe. Dr. Lumbwe, can you, I'm sure
Yes,
you've worked in health system where like Ghana or Rwanda, where they're still using paper-based medical records.
Yes, I'm not sure I fully understand the question, but I think that if you use a value assessment, for example, it can help you to make a case for a digital health intervention, sort of like an investment case, and you can be able to see the cost benefit of either using paper-based or digital solutions for medical records. And I think that that opportunity is there. And if you use a guide like this one, it gives you a transparent way of making these value judgments or value assessments, and that you get your stakeholders on board. And it helps to galvanize support and so on and so forth. So I think there's a lot of benefits in using a guidance such as this one.
Yes. Thank you very much, Dr. Lumbwe. We have Luvimbo Savanyu, who is asking, looking at cervical cancer treatment in rural clinics, how can the assessment be integrated to improve efficiency of mobile data system like the HIS2? So to answer this question, the guidance can be used over various tools, whether it's a tool that is being used via a computer or a tablet or a mobile data system. So there's nothing else that you would need to be able to use the guidance. It is very much adapted to tools are being used over phones or needing mobile data. And it can very much assess, I believe, the DHIS2. And then we have Sami asking, in addition to will and desire, what other criteria should be fulfilled by a particular city? I see Issa answering that, yes. And then we have another question, what specific steps startups or private organizations can take to involve and associate with healthcare providers in adapting digital health solutions to deliver care for their patients? I'll ask Dr. Izuna to answer this question. So it says, what specific steps startups or private organizations can take to involve and associate with healthcare providers in adapting digital health solutions to deliver care for their patients? I believe that's one of the things that you've been doing in Malaysia to sort of facilitate these dialogues. Yes.
Yes, I think it depends on your healthcare system itself. But I think you can approach, if you have HTA agencies, you can approach your HTA agencies. They may actually help you in terms of how you may introduce this technology to your healthcare provider. If you do not have an HTA agencies, I think you can approach your Ministry of Health to introduce this technology itself. So like in our situation, you can approach us in Malaysia to introduce this technology. So we will look at the value assessment to evaluate your technology. Thank you.
Yes, thank you very much. And just to add on that, I think one other ways, there are several initiatives that are being done in various countries to facilitate dialogues between the users like healthcare providers and startup companies in different initiatives in Africa and elsewhere. But I really think the important step is to make sure that you've included the user in the initial step of the designing of the system to ensure adoption at the later stage. So I see that we don't have any further questions on the chat. Yes. So I think, and we are almost done with our time. So you've seen in the chat, we've shared our emails and contacts. My email and my other colleague Fred, and we will share with you in the following days the slides and the guidance. Please reach out if you have any feedback or if you want to hear more about it or how it can be used. We are very happy, we'll be very happy to have a discussion with you. And if there are any further questions that you have, please feel free to send them via email. We also make sure that you get your responses. I want to really take this opportunity to thank you all for dialing in and joining our webinar. We hope it has been beneficial to you. We really look forward to continue to speaking with you for any potential collaboration afterwards, and really to continue to improve how digital health intervention are being evaluated in low and middle income countries. We thank very much our speakers, Dr. Ishmael, Dr. Izuna, Isabel, and Dr. Lumbwe. Thank you for sharing your knowledge and expertise with us. And thank you, everyone. Thank you for participating. I wish you a rest, good of a day, if it's in the evening or morning, wherever, depending on where you are. Thank you so much. This is the end of our webinar.